If you wake up with dry mouth, your body is warning you. Almost nobody knows this. A sensation as seemingly innocuous as waking up with a dry mouth can be an unsettling start to the day. For many, it's quickly dismissed with a sip of water, an assumed consequence of a night's sleep, or perhaps inadequate hydration. Yet, this often overlooked symptom, far from being a mere inconvenience, can be an early, persistent signal from your body, subtly broadcasting a warning about more profound underlying health issues. We are talking about potential precursors to conditions as serious as poor circulation, significant memory loss, and even the grave implications of heart failure. These are not isolated occurrences, but interconnected challenges that can silently unfold, often masked by what appears to be a minor transient discomfort. What if that persistent morning dryness has absolutely nothing to do with how much water you consumed the previous day, or even how much you drank right before bed? What if instead it's your body's nuanced language, a critical message it has been attempting to convey for weeks, months, or perhaps even years, a language that too few of us have been taught to interpret? This reality is startling, and the implications of this widespread misunderstanding are what compel us to delve deeper. The true scope of this issue is truly arresting. Chronic morning dry mouth is not a rare phenomenon. It quietly impacts nearly 1 in 3 adults once they cross the age of 60. What's even more crucial to understand is that in the vast majority of these cases, the genesis of this dryness bears no relation to the quantity of water ingested before bedtime. It has nothing to do with a simple thirst response. Despite its prevalence and the critical signals it might represent, this isn't a topic commonly discussed in the hurried aisles of pharmacies, nor is it given the focused attention it deserves during most routine annual checkups. The conversation, quite simply, isn't happening. It remains a largely unaddressed aspect of adult health, leaving millions unaware of potentially serious health implications. It is imperative to stay engaged through this exploration, as the most significant cause we are about to uncover today is likely something quietly residing within your medicine cabinet or on your nightstand, an item you interact with daily, potentially causing far more damage than merely parching your mouth. The ramifications extend far beyond oral discomfort, touching upon the vital functions of your kidneys, the strength of your heart, and the clarity of your brain, affecting these critical organs simultaneously and often insidiously. My name is Dr. Amelia Lawson, and I am a physician with over a decade of intensive clinical experience, primarily dedicated to understanding and improving the health of adults over the age of 60. Throughout my career, I've had countless consultations with men and women who initially presented with symptoms they considered minor, almost inconsequential. Yet, upon closer examination and a more comprehensive approach, we frequently uncovered serious, often hidden, underlying conditions. These conditions had been silently progressing, cleverly concealed behind that one small, easily dismissed symptom. It's a pattern I've observed repeatedly, underscoring the critical importance of truly listening to the body's signals, no matter how subtle they may appear. Morning dry mouth stands as a quintessential example of precisely this kind of symptom. On the surface, it presents as deceptively simple, and annoyance rather than a concern. However, beneath that apparent simplicity lies the profound potential for it to be life-changing, either for the worse if ignored, or for the better if understood and addressed. What I am about to share challenges a pervasive societal belief, a quiet conditioning that many of us have unconsciously accepted. The notion that aging inherently means discomfort, or that a perpetually dry mouth is simply an inevitable, unavoidable sensation that comes with getting older. I want to be unequivocally direct with you. This widely held belief is not the complete truth. After witnessing over 10 years of patients enduring unnecessary suffering that could have been avoided had this crucial information reached them sooner, I am no longer willing to remain silent on this vital issue. The time for a candid, comprehensive discussion is now. If you find this information helpful, a simple click of the like button can make a significant difference. It assists in ensuring that this crucial message reaches the individuals who genuinely need to hear it, extending its reach to those who might otherwise continue to suffer in silence. Let's now meticulously explore the intricate biological processes unfolding within your body on those mornings when you awaken feeling as though your mouth has been transformed into cotton. Your mouth relies critically on a continuous, uninterrupted supply of saliva, a substance that is far more complex and sophisticated than mere water. Saliva is, in essence, a highly evolved biological fluid, a dynamic cocktail of essential components. It carries an array of digestive enzymes, which initiate the breakdown of food even before it reaches your stomach. It's rich in antimicrobial proteins, serving as a frontline defense against invading bacteria, fungi, and viruses. It contains vital minerals that help remineralize tooth enamel, offering a continuous shield against decay. Furthermore, it boasts a sophisticated collection of protective compounds that collectively defend your teeth, safeguard your gums from inflammation and disease, lubricate your throat for comfortable swallowing, aid your overall digestion, and play an integral role in maintaining your immune system's integrity around the clock. This constant bathing action is indispensable for maintaining oral health and, by extension, systemic well-being. As we age, a natural physiological shift occurs. After the age of 60, your body typically begins to produce approximately 30 to 40% less saliva than it did during your 40s. This reduction in isolation creates a significant physiological vulnerability within the oral cavity. However, this inherent age-related decline transforms into a genuinely precarious situation when it combines with the 7 underlying causes I am about to meticulously detail. This is because none of these causes simply result in a dry mouth as an isolated symptom. Every single one of them serves as a critical indicator, pointing toward a deeper, more systemic issue unfolding within the complex network of your body. From a clinician's perspective, what concerns me most deeply is the compelling research linking chronic dry mouth to a staggering 45% higher risk of systemic infection in adults over the age of 60. Saliva acts as your mouth's primary frontline immune defense system. When this crucial protective barrier is diminished or entirely removed, bacteria, fungi, and viruses gain an unimpeded direct pathway into your bloodstream, potentially triggering widespread infections that can significantly compromise overall health. Therefore, let us meticulously navigate through all 7 of these critical causes, progressing from the least immediately serious to the one that elicits the greatest concern in a clinical setting. By the time we conclude this detailed exploration, you will possess a comprehensive understanding of precisely what symptoms to monitor, what specific questions to pose to your healthcare provider, and what actionable changes you can implement, starting as early as tonight, to safeguard your health. Before we embark on this vital discussion, I want to ask you a deeply personal question, one that can illuminate the gravity of your individual situation and potentially help others. How long have you been consistently waking up with a dry mouth? Has it been a mere few weeks, an ongoing struggle for several months, or has this become a persistent reality for many years? Your candid response, shared in the comments below, is invaluable. I genuinely read every single one, and your willingness to share your experience not only aids in understanding the collective scope of this issue, but also serves as a powerful reminder to someone else watching this that they are not alone in their struggle. Number 7 on our comprehensive list identifies the most common cause I encounter in my practice, yet it is also, paradoxically, the most frequently dismissed: mouth breathing during sleep. Before you instinctively dismiss this point, perhaps thinking it's either an obvious habit or entirely harmless, I urge you to pause and absorb a crucial distinction. In my extensive clinical experience, mouth breathing during sleep is almost never merely an isolated habit. Rather, in nearly all instances, it functions as a clear symptom of a more profound underlying condition. This crucial distinction carries enormous weight in understanding and addressing the issue effectively. When you breathe through your mouth throughout the night, there is a continuous, unimpeded flow of air directly across your tongue, your palate, and the delicate tissues at the back of your throat. This constant evaporative air current rapidly depletes moisture from your oral cavity at a rate that your salivary glands, which naturally slow down significantly during sleep, simply cannot adequately replenish. The physiological consequence of this imbalance is that unmistakable sandpaper-like sensation upon waking, often accompanied by visibly cracked lips, a noticeably thick or coated tongue, and sometimes even a sore throat that, surprisingly, has no connection to any infectious illness, but is purely a result of severe dryness and irritation. However, the concern extends far beyond the immediate discomfort of a dry mouth. This is the aspect that compels my deepest attention as a clinician. Mouth breathing during sleep is very frequently driven by more serious physiological obstructions or conditions. These can include chronic nasal congestion, often stemming from allergies, infections, or environmental irritants. A deviated septum, a structural abnormality within the nose that restricts airflow, nasal polyps, non-cancerous growths that can block nasal passages, or most significantly, sleep apnea. Sleep apnea, in particular, is not a condition to be casually dismissed or ignored. It represents a serious medical disorder characterized by repeated pauses in breathing or shallow breaths during sleep. These interruptions can lead to significant drops in blood oxygen levels, placing immense stress on the cardiovascular system and other vital organs. Extensive research has unequivocally demonstrated that untreated sleep apnea is directly linked to a substantial 60% increased risk of stroke, a debilitating cerebrovascular event, and a 40% increased risk of heart failure, a progressive and life-threatening condition where the heart cannot pump enough blood to meet the body's needs. Therefore, if you consistently awaken with a dry mouth and also exhibit other concerning symptoms such as persistent snoring, a feeling of being unrested despite a full night's sleep, or if a close family member or partner has observed instances where you momentarily stop breathing during the night, please do not rationalize these observations as simply the way you sleep. These are not benign quirks. It is critically important to initiate a conversation with your doctor about undergoing a comprehensive sleep study. That single conversation and the subsequent diagnostic process holds the potential to impact your health and longevity far more profoundly than you might currently realize. For individuals whose mouth breathing is not indicative of an underlying condition like sleep apnea, the practical, non-invasive solutions are remarkably straightforward and often highly effective. A simple nasal strip, strategically placed across the bridge of your nose before bed, can significantly enhance nasal airflow by gently opening the nasal passages. This encourages your body to revert to its natural, intended mode of breathing through the nose, which is inherently more efficient and less drying for the mouth. Incorporating a humidifier into your bedroom, maintained at an optimal humidity level between 40 and 50%, dramatically reduces overnight moisture loss from your oral and nasal membranes. Switching to a side sleeping position can also naturally diminish the tendency to breathe through your mouth as gravity works to keep the airway more open. Finally, a small strip of specialized surgical tape applied vertically over the lips before sleep is a technique long employed by sleep specialists. This gentle yet consistent method effectively trains mouth breathers to transition back toward nasal breathing, often yielding noticeable improvements within the first week of consistent application. These simple interventions can collectively restore a more natural and protective breathing pattern during sleep, alleviating dry mouth and addressing its associated risks. Number 6 highlights a mistake I observe with remarkable consistency, a practice that, on the surface, appears entirely logical until one truly grasps the underlying physiological reasons why it fails to deliver the desired results. Most individuals who wake up with a persistent dry mouth instinctively assume the solution is straightforward. They believe they simply need to consume more water before going to bed. Consequently, they conscientiously implement this strategy, perhaps finishing a large glass of water or two immediately before turning off the lights. Yet, despite their diligent effort, they awaken the following morning just as parched as before, sometimes even more frustrated because they felt they had diligently followed the correct advice, only to experience no discernible change. The reason for this frustrating lack of efficacy lies in a fundamental principle of human physiology. Your body does not achieve optimal hydration in real time or instantaneously. When you ingest water, it is not immediately available for cellular processes. Instead, it undergoes a complex journey through your digestive system, requiring anywhere from 30 minutes to a full 2 hours for that fluid to be properly absorbed into your bloodstream, meticulously distributed to your various tissues and organs, and then made truly available for crucial physiological functions, such as the production of saliva. Therefore, water consumed at 10 diets at night contributes very little, if anything, to the moisture levels in your mouth at 6 car the following morning. By that time, the critical window for its effective utilization during the night has already decisively closed. The real crux of the problem often lies not in what happened or didn't happen in the hours immediately preceding sleep, but rather in the hydration patterns established much earlier in the day, particularly during the afternoon. Compelling research has illuminated this point, demonstrating that adults over the age of 60 who failed to maintain an adequate and consistent fluid intake between the hours of noon and 4 in the afternoon were a significant 62% more likely to experience considerable overnight dry mouth when compared to their counterparts who consistently remained well hydrated throughout the day. A 62% difference is not a subtle variance. It represents a profound impact on physiological function. Furthermore, after the age of 60, managing hydration naturally becomes an inherently more challenging task because the body's intrinsic thirst mechanism, a crucial regulator of fluid intake, demonstrably becomes less reliable and less sensitive with advancing age. This physiological shift means that you can be meaningfully and even dangerously dehydrated without experiencing any particular urge or sensation of thirst to prompt you to drink. Many individuals also, quite understandably, consciously reduce their fluid intake during the late afternoon and evening hours to minimize the frequency of disruptive nighttime bathroom trips. While this decision is completely logical from a comfort perspective, it inadvertently creates a significant hydration deficit that reaches its peak precisely at a time when you have no practical means to actively correct it. Overnight, when you are asleep and not drinking. The genuine, effective solution, therefore, is not to force more water down right before bed. Instead, it lies in strategically front-loading your hydration earlier in the day. A practical and highly effective approach is to aim for a consistent intake of 6 to 8 ounces of water with every meal and with every afternoon snack. This ensures a steady, sustained supply of fluid to your system throughout the day, allowing for proper absorption and distribution well before nighttime. And here is a small yet remarkably effective professional tip to further enhance your hydration strategy. Consider adding a tiny pinch of high-quality sea salt and a squeeze of fresh lemon juice to your afternoon water. This simple addition is not merely for flavor, it actively supports optimal electrolyte balance within your body. Electrolytes, such as sodium and potassium, are critical for cellular function and play a pivotal role in helping your cells actually hold onto the fluid you consume rather than allowing it to pass straight through your system without being properly utilized. This intelligent approach to hydration significantly improves the body's ability to retain and utilize water, mitigating the effects of overnight dryness. Number 5 on our list often catches almost everyone by surprise because we seldom intuitively connect the nuanced realm of nutrition to a direct, tangible symptom occurring every single morning in your mouth. Yet, the link is undeniable and profound. Your salivary glands are far from passive structures. They are highly metabolically active tissues, intricate biological factories that demand a precise and continuous supply of specific micronutrients to function optimally at a fundamental cellular level. Among the multitude of essential nutrients, Two particular deficiencies are known to devastate salivary gland function in adults over the age of 60 with a speed and severity unmatched by almost anything else. The first critical nutrient is vitamin A. This fat-soluble vitamin is absolutely indispensable for maintaining the robust health and structural integrity of every mucous membrane throughout your entire body. This includes the delicate lining of your mouth, the protective tissues of your throat, the intricate pathways of your nasal passages, and the extensive lining of your digestive tract. These membranes serve as crucial barriers and secretors of protective fluids, and their health is directly dependent on adequate vitamin A. When vitamin A levels within the body begin to decline, these vital membranes undergo a detrimental transformation. They become noticeably thinner, significantly drier, and progressively less functional, losing their ability to adequately produce and retain moisture. Research has starkly illustrated this impact, revealing that adults over 60 with suboptimal vitamin A levels exhibited a dramatic 41% reduction in resting saliva production compared to those with sufficient levels. This is not a subtle, negligible effect. It unequivocally indicates that your salivary glands are operating on a mere fraction of their inherent capacity, severely compromising their protective functions. The second crucial category involves the B vitamins, with particular emphasis on B3, commonly known as niacin and B12. Niacin deficiency directly interferes with the intricate nervous system signals that are responsible for triggering the very first step of saliva production. Without these properly functioning signals, the salivary glands simply do not receive the command to initiate their secretory activity. Meanwhile, a deficiency in B12, often prevalent in older adults, leads to a specific oral condition known as glossitis, where the tongue becomes inflamed, abnormally smooth, losing its normal papillae, and persistently dry. This combination of compromised neural signaling, B3, and direct tissue inflammation dysfunction, B12, creates a persistent dry mouth sensation that no amount of water will fully alleviate. This is because the root of the problem is not a simple lack of hydration. It is a fundamental breakdown in cellular function and neurological communication. It's particularly important to note that after the age of 60, the body's ability to absorb B12 from dietary sources significantly diminishes. This is primarily due to a natural reduction in stomach acid production, which is essential for releasing B12 from food proteins, and often a corresponding decrease in intrinsic factor, a protein necessary for B12 absorption in the small intestine. Consequently, research suggests that a substantial proportion, up to 30% of older adults, suffer from inadequate B12 levels without any awareness whatsoever of this crucial deficiency. For those seeking to address these nutritional gaps through diet, focus on incorporating sweet potatoes, vibrant dark leafy greens, and eggs for a rich supply of vitamin A. For B12, prioritize lean meats, various types of fish, and dairy products. However, for many adults over 60, dietary intake alone may not suffice, making supplementation a necessary and effective strategy. When selecting a B-complex supplement, look for one that provides at least 1,000 micrograms of B12 in the methylcobalamin form, as this is recognized as the most bioavailable and easily utilized version by the body. And here's a valuable practical tip. Vitamin A is a fat-soluble vitamin. This means its absorption is vastly more efficient when consumed concurrently with a small amount of healthy fat. A light drizzle of high-quality olive oil over your vegetables or a few slices of fresh avocado incorporated into your meal can make a genuine and measurable difference in how effectively your body utilizes this vital nutrient. Number 4 represents a combination of symptoms that I approach with the utmost gravity in my medical practice. If this particular pairing resonates with your experience, it is absolutely essential that you absorb this information clearly, not with fear or alarm, but with the empowering understanding that early knowledge is truly everything. If you are consistently waking up with a dry mouth and you are also finding yourself getting up to urinate more than once during the night, this specific pairing of symptoms constitutes a distinct clinical warning flag that I never, under any circumstances, ignore. Together, Together, these two seemingly disparate symptoms are among the earliest and most telling indicators of uncontrolled blood sugar levels, and in a significant number of cases, they signal the insidious onset of undiagnosed type 2 diabetes. Let's delve into the precise physiological mechanism that links these symptoms. When blood sugar levels in the body consistently climb above a healthy, controlled threshold, the kidneys, our body's diligent filtration system, are forced to work excessively over time. Their strenuous task becomes filtering and excreting the surplus glucose that the body cannot properly manage. To accomplish this demanding process, the kidneys draw an abnormal amount of water from the body's various tissues. This internal fluid loss effectively dehydrates you from the inside out, creating a systemic fluid deficit. One of the very first places you feel this pronounced dehydration is, quite noticeably, in your mouth, particularly overnight when there is nothing you can actively do to compensate for this internal fluid drain. The critical importance of this symptom pairing lies in its timeline. Research has unequivocally demonstrated that morning dry mouth was reported by a striking 60% of adults who were newly diagnosed with type 2 diabetes. What's even more alarming is that the vast majority of these individuals had been experiencing this persistent symptom for well over a year before they finally received their diagnosis. This means their body had been diligently signaling that something was fundamentally amiss every single morning for an extended period, yet the message often went unheeded or misinterpreted. I recall a specific patient of mine, a vibrant retired woman in her early 70s, who was notably sharp and active. She initially came to me for a completely unrelated concern. It was almost as an afterthought as she was preparing to leave the examination room that she casually mentioned her dry mouth. Recognizing the significance of this seemingly minor detail, I immediately asked a few targeted follow-up questions. Was she waking during the night to use the bathroom? Yes, regularly, she confirmed. Had she noticed any unusual fatigue in the afternoons? Definitely, she replied. Based on these seemingly small but profoundly important clues, I immediately ordered a fasting blood glucose panel for her that very same week. The result came back at 148 milliliters per deciliter, a clear indicator of elevated blood sugar. She had unknowingly been living with undiagnosed type 2 diabetes for well over a year. Within a span of just 4 months, through a dedicated regimen of targeted dietary changes, consistent daily movement, and strategic supplementation with berberine and magnesium glycinate, both known for their benefits in glucose metabolism, her fasting glucose levels had normalized beautifully. At her follow-up appointment, she shared with genuine relief, "I finally feel like my body is working with me again." This powerful anecdote perfectly illustrates what catching something early truly looks like. It's not a moment of crisis or despair. Instead, it transforms into an invaluable opportunity for proactive intervention and a return to vibrant health. Number 3 on our list brings to light a debilitating condition that silently affects an estimated 4 million Americans. Despite its significant prevalence, the average patient endures a disheartening wait of nearly 3 years from the initial onset of their symptoms to the eventual moment they finally receive an accurate diagnosis. 3 years. This isn't merely a small gap in medical knowledge or an oversight in diagnostic protocols. It represents a profound systemic chasm in the quality and depth of conversations occurring within examination rooms, a failure to connect seemingly disparate dots. The condition in question is Sjogren's syndrome. It is a chronic, systemic autoimmune disorder, meaning the body's own immune system, mistakenly identifying healthy tissues as foreign invaders, launches an attack against them. In Sjogren's, the primary targets are the body's moisture-producing glands, predominantly the salivary glands located in the mouth and the tear glands situated in the eyes. This misguided assault leads to a cascade of debilitating symptoms: persistent and often severe dry mouth, xerostomia, chronic and irritating dry eyes, keratoconjunctivitis sicca, and frequently significant difficulty swallowing, dysphagia, due to inadequate lubrication. In more advanced stages, Sjögren's can become systemic, extending its damaging reach to other vital organs and tissues, manifesting as widespread joint pain resembling arthritis, profound and pervasive fatigue that is not alleviated by rest, and, in some cases, affecting the delicate functions of the kidneys and lungs. It is particularly important to note that women over the age of 60 are disproportionately affected by Sjögren's syndrome, representing a staggering nearly 90% of all diagnosed cases, underscoring a significant gender-based predisposition. So, given its prevalence and potential for systemic damage, why does it take such an agonizingly long time to accurately identify and diagnose Sjögren's syndrome? The primary reason stems from the fragmented, siloed approach often taken in healthcare. Each individual symptom tends to be treated in isolation, without an overarching perspective that connects them. The persistent dry mouth is routinely dismissed as a natural consequence of aging or simply attributed to dehydration. The chronic dry eyes are often mislabeled as a result of excessive screen time, seasonal allergies, or mere eye strain. The widespread joint pain is too readily classified as generic arthritis, a common ailment of aging. Consequently, no single healthcare provider connects these seemingly disparate dots, and the insidious underlying autoimmune process is allowed to continue its destructive course entirely unchecked, often for years, causing cumulative damage. The crucial diagnostic clue I want to embed firmly in your awareness is this: if your chronic dry mouth is consistently and persistently accompanied by eyes that feel perpetually dry, gritty, or experiencing a burning sensation, and most especially if you are a woman over the age of 60, please take proactive steps. Ask your doctor specifically about Sjögren's syndrome by name. Do not wait for them to suggest it. A definitive diagnosis can typically be achieved through a simple blood test that measures the presence of two specific autoantibodies, anti-SSA, also known as anti-Rho, and anti-SSB, also known as anti-LA. The presence of these antibodies in the bloodstream can identify the condition in the majority of cases. You are absolutely entitled to request this test. Do not hesitate or wait for someone else to offer it. Your advocacy is paramount in accelerating diagnosis. While there is currently no definitive cure for Sjögren's syndrome, there are highly effective treatments and management strategies available that can significantly alleviate symptoms, improve quality of life, and crucially, slow the progression of the disease, minimizing long-term complications. For immediate symptomatic relief while you pursue a diagnosis and treatment plan, chewing sugar-free gum containing xylitol is one of the most accessible and effective tools available without a prescription. Not only does it stimulate natural saliva production, helping to moisten the mouth, but xylitol also possesses the invaluable property of inhibiting the growth of decay-causing bacteria, which unfortunately flourish in the low saliva environment that dry mouth creates, providing a dual benefit. Number 2 on our critical list identifies a connection that most people would never intuitively link to a dry mouth, yet the scientific link is unequivocally real, meticulously documented, and every adult over the age of 60 deserves to be fully aware of it. Your salivary glands do not operate as independent, isolated units within your body. On the contrary, their function is meticulously governed by the intricate workings of the autonomic nervous system, specifically the parasympathetic branch. This crucial division of the nervous system is the orchestrator of the body's fundamental rest and digest functions, overseeing essential processes like recovery, relaxation, and, naturally, all aspects of digestion, including saliva production. When this vital system becomes compromised, its regulatory control over salivary activity begins to decline, leading directly to a reduction in saliva flow, and consequently, the mouth dries out. What makes this particular connection so profoundly significant is the established fact that autonomic nervous system dysfunction is a recognized and often early feature of several serious neurodegenerative diseases, most notably Parkinson's disease and Lewy body dementia. Troubling research has meticulously shown that these subtle yet detectable autonomic changes can manifest a significant 4 to 6 years before the emergence of the classical motor symptoms, such as tremors, rigidity, and bradykinesia, that typically prompt a diagnosis of Parkinson's or Lewy body dementia. This extended preclinical phase offers a crucial window for potential early intervention. I am reminded of a patient, a retired man in his late 70s, whose demeanor was always methodical and quietly observant. He had mentioned a persistent dry mouth across several visits to my office. Together, we had diligently worked through the more obvious explanations, reviewing his medications, assessing his sleep position, and emphasizing hydration strategies. Yet, despite our efforts, nothing seemed to fully resolve his discomfort. Then, during one particular appointment, his wife mentioned, almost as a casual aside, that he had recently stopped recognizing the distinctive smell of his morning coffee. He had noticed this change himself, but had said nothing, presuming it was an unrelated, insignificant detail of aging. Crucially, it was not unrelated. This seemingly minor sensory change, combined with his persistent dry mouth, formed a critical piece of the puzzle. I immediately referred him to a neurologist for further evaluation. Subsequent advanced brain imaging and neurological assessments ultimately confirmed an early diagnosis of Parkinson's disease. While the diagnosis was understandably a profound shock, the fact that we had uncovered it at such an early stage proved invaluable. This afforded him the precious opportunity to promptly begin neuroprotective therapy and, equally importantly, to meticulously build a comprehensive care plan well before the development of significant, life-altering motor symptoms. 3 years later, his quality of life remains genuinely good, a testament to the power of early detection and intervention. At a recent follow-up visit, he reflected, "I almost didn't mention the dry mouth. I thought it was too small a thing to bring up." This poignant statement serves as a powerful reminder. Nothing is ever too small or insignificant to bring up when discussing your health. Your body is an extraordinarily complex and intelligent system, and it is constantly communicating with you through a myriad of signals. Our collective job, yours and mine together, is to learn how to truly listen and understand that communication. Finally, we arrive at number 1, the cause I encounter with the most alarming frequency in my clinical practice. It is also, regrettably, the one that is most consistently overlooked, most inadequately communicated between healthcare providers and patients, and, in my unequivocal opinion, the most deserving of a direct, honest, and comprehensive conversation. The sheer scale of this issue is staggering. Over 500 commonly prescribed medications list dry mouth as a potential side effect. Over 500 distinct pharmaceutical agents for adults over the age of 60 who, on average, are managing multiple health conditions and consequently take an average of 5 or more prescription medications daily. The cumulative impact of these drugs on salivary function, and more critically, on overall brain health, can be profoundly detrimental and far-reaching. The drug classes most frequently implicated in causing significant dry mouth include, but are not limited to, a broad range of antihistamines, often found in over-the-counter sleep aids and allergy medications, various antidepressants, numerous types of blood pressure medications, medications specifically designed to address bladder control issues, certain antipsychotics, and a variety of pain medications, including many muscle relaxants. What elevates this particular cause from a mere inconvenience to a genuinely dangerous health concern is a crucial pharmacological concept known as anticholinergic burden. This term refers to the cumulative neurological effect exerted by multiple medications that either intentionally or inadvertently block the action of acetylcholine, which is a pivotal neurotransmitter. Acetylcholine plays an indispensable role in a vast array of bodily functions, including learning, memory, muscle contraction, and crucially, the stimulation of glandular secretions such as saliva. When its action is impeded by multiple anticholinergic drugs, the consequences extend far beyond a dry mouth. High anticholinergic burden has been rigorously linked in multiple large-scale, robust research studies to an accelerated rate of cognitive decline, meaning a faster deterioration of mental abilities and a significantly elevated risk of developing dementia. The persistent dry mouth in this context is not merely the end point of the drug's effect. Rather, it serves as a highly visible, palpable signal of something much deeper and potentially more insidious occurring within the delicate neurochemical balance of the brain. It is a physiological warning light that should never be ignored. I am reminded of a patient, a retired man in his mid-70s, who vividly described waking up every single morning feeling as though he had literally swallowed chalk. He had been on the same complex combination of medications for years, prescribed by different specialists over time. Crucially, no single prescribing doctor had ever taken the time or possessed the comprehensive perspective to review his entire medication list holistically. This fragmented approach meant that the cumulative anticholinergic effects of his various drugs went unrecognized. During a thorough medication reconciliation process at my clinic, we meticulously identified 2 specific drugs that had significant overlapping anticholinergic effects, essentially compounding the problem. After careful consideration, we discovered that both of these medications had safer, equally effective alternatives available that did not carry such a heavy anticholinergic load. We made 2 strategic substitutions to his regimen. Within a matter of weeks, he began to notice a tangible difference in his oral comfort. Within 2 months, he reported back with palpable relief and renewed clarity, stating, "I wake up feeling like a normal person again, and my thinking feels sharper than it has in years." This was not a mere coincidence. It was a direct and profound consequence of intelligently addressing his anticholinergic burden. Here is your clear, actionable plan designed to empower you starting tonight. Firstly, definitively stop taking any over-the-counter sleep aid that contains diphenhydramine. This common antihistamine has potent anticholinergic effects that significantly contribute to morning dry mouth and can negatively impact cognitive function. A far gentler and often equally effective alternative for promoting sleep is melatonin, typically at a low dosage of 0.5 to 1 milligram. Secondly, consistently run a humidifier in your bedroom, aiming to maintain a comfortable humidity level between 40 and 50%. This simple environmental adjustment dramatically reduces overnight moisture loss from your oral and nasal passages. Thirdly, proactively front-load your hydration throughout the afternoon. As discussed, drinking more water earlier in the day ensures your body is adequately hydrated before the night, preventing the deep cellular dehydration that peaks overnight. Fourthly, make it a habit to brush with a fluoride toothpaste specifically formulated for dry mouth before bed. These toothpastes often contain ingredients designed to soothe oral tissues and protect against the increased risk of decay associated with reduced saliva. Finally, tonight, consider trying a nasal strip to encourage nasal breathing and minimize mouth breathing during sleep. Then, crucially, this week, take the time to meticulously write down every single medication you take. This includes prescription drugs, over-the-counter remedies, vitamins, and any supplements. Bring this comprehensive list to your next doctor's appointment. Engage in a direct conversation with your physician. Ask them explicitly, do any of these medications suppress saliva production? And if so, are there safer, equally effective alternatives available? This direct question is your right as a patient and can be a pivotal step in safeguarding your health. Understand this deeply. You are not broken. Your body is not simply failing because of age. Often, the challenge lies not within you, but in the fact that your information has simply been incomplete, fragmented, or misunderstood. And starting right now with this knowledge, that fundamental reality changes. If this comprehensive exploration has provided you with valuable insights and empowerments, please show your support by hitting that like button. Consider subscribing to this channel for a continuous stream of real, evidence-based health solutions meticulously tailored for adults over 60. And perhaps most importantly, share this vital information with someone you genuinely care about, a friend, a cherished family member, a spouse. You may just be providing them with that single critical piece of information that has the power to change everything for their health and well-being. and I sincerely want to hear from you. Which of these 7 distinct causes surprised you the most? Which one resonated so deeply that it made you think, that might very well be me? Share your thoughtful answer in the comments section below. I truly value and want to understand your personal story. Because remember, while aging brings its own unique set of changes, it absolutely does not diminish your body's innate capacity to heal, adapt, and recover. It simply serves as a profound and constant reminder to care for it, intelligently and diligently, in precisely the right way. Take exceptional care of yourself.